Hi everyone, and welcome to episode 4 of The Only Way is Ethics. We've had so far the first 3 episodes. We've had 2 fantastic guests. It's going to be a shorter episode this week, and it's just going to be me. We don't have a guest for episode 4, but just in reflection on the first 3 episodes. So as part of that, we've had 2 fantastic guests. We had Kaye Reynolds and we've had Kimberley Dawson. And we've had some really interesting discussion in relation to a number of topics, including maintaining safety documentation as part of a team, developing a competency framework for CSOs, core curriculum for health professionals on clinical risk management, and how we can try and get that introduced, whether that's through the NMC, GMC, or through the universities, on reflection and advice given from Wendy Deering when I had a chat with her. Interestingly, talking to Kimberley Dawson as well, and she punned the 3 pillars of digital health projects for her and her organisation: information governance, clinical safety, and cyber security. And that if those 3 aren't achieved, then manufacturers aren't even let through the door, which is really interesting, and adds that robustness to the process. Also talking about learning from our mistakes and using those to improve future projects, which I think is absolutely key, isn't it? If we can't improve and we can't make sure that process works for us in our organisations, then we need to go back to the drawing board. And interestingly, Kimberley talking about pre-project checklists for clinical risk management and mandating all project team members completing the clinical risk management essentials training as well as part of that project process in preparation for clinical risk management activities, and embedding that process. Also, DCB 0129 and 116, do they give a clear perspective of what to do next within the clinical risk management process? There's some work to do there in relation to the standards, and we know that work is going to be happening at some point in the near future around the revision and that going out for consultancy. And lastly, transparency, where suppliers can give an account of the benefits of their system. However, do they demonstrate that effectively when challenged? And there's some interesting discussion around that. So it's been really interesting. It's been really good to get the podcast up and running. And thank you for all those that have subscribed and are listening. We're in our infancy at the moment. We've got 3 fantastic episodes coming up, which we're in the throes of recording. So as part of that, episode 5, we're going to be speaking to Clive Flashman, who will be quizzing on his experiences as part of patient safety learning, talking about the reported issues with NHS IT systems and much more with Clive. And that's going to be a really interesting conversation. Then episode 6, we have Leah Parry, who is CNIO for Bristol and Western, and I work with Leah and her team, and picking up on her minidisc analogy and the blog that she put out on LinkedIn, which I found really interesting. So we'll be chatting about that in regards to digital health technologies and looking at Leah's experience in relation to the adoption of those technologies within the NHS and within our organisation. And then lastly, out of those 3 episodes, episode 7, we'll be talking to Shane Tickell. So Shane and me worked at IMS Maxims for 11 years, and I know Shane worked for a few years more. So we're going to be talking to Shane about the importance of data, its integrity, and how we can harness its richness to support our healthcare community, and his experience as well as a supplier in relation to clinical risk management and what that means for him and his experiences. So that's our next 3 episodes, and I'm really sort of looking forward to getting those done and putting them out there really for everyone to see. I said it's going to be a short episode, but what I wanted to touch on in this episode and just discuss and get people's viewpoints, and I'd really like people to pick up on this, is around something that has come to the forefront over the past few months, and frankly has caused a lot of upset within a group of clinical safety officers, and really isn't doing us any favours for the movement and support of health organisations in trying to achieve safe and effective delivery of projects and care. And what I'm actually talking about is certain C-suite digital clinicians, senior leaders, letting everybody know that clinical safety is nothing to do with them, and that they are not interested if anyone comes to them with any issues, and quoted as saying it is someone else's job, not mine. Okay. Where do I start with this? I was really upset by these comments. They've been made to me, and I know they've been made to other CSOs as well. And I was approached as well by a digital matron, actually, when delivering some training, who had the same issue. And whether you're CNIO, CXIO, CCIO, within digital transformation programs, and you're part of that senior leadership team within your health organisations, and you have a pivotal role to play. And if people are under the impression that clinical risk management is nothing to do with them and they don't have a responsibility within those roles, they're sadly mistaken. And I'm really questioning how have we got to that point where these individuals have that impression, are quite happy to communicate to that effect on forums. So it's where we've got existing forums like the CSO Coffee and Chat. There are now regional CSO forums, and we've also got the Digital Health Council and channel that's out there and has been set up. And we're really trying to push the message and raise awareness and get the backing and the support of not just the clinical community, but the wider community within digital health to make sure that, you know, not just the NHS safety standards, but what we're doing in our day-to-day practice is always thinking about the patient and always thinking about, okay, where in the use of this system and in enabling digital health systems, where could this possibly cause harm to the patient, and how can we reduce that risk? And we're trying to do that and bang that drum. And then there's certain people out there that seem to be sort of putting a spanner in the works. So I did sort of a bit of digging around, obviously, on the internet, and I've just got some sort of I just took some snippets out of, and I used CNIO job descriptions as an example. But, you know, for instance, this role will be the lead for the practice development of digital capabilities and competencies for our nursing, midwifery and AHP workforce across both acute and community teams, which screams lead by example in relation to that statement. Another statement within there, working with the Group Chief Nurse and Hospital Director of Nursing, Divisional Directors of Nursing, matrons and other members of the multi-professional team in the design and delivery of patient pathways to enhance clinical outcomes, patient safety and patient experience. And another example clearly stated that within that role, was to improve safety and reduce avoidable harm. Okay, so I asked the question, where in any of those statements would anyone within those roles, and this is a challenge to people within those roles, and I'd ask you to reach out as well and give your opinion. If any of you feel that clinical risk management isn't part of that role, and you are not in a privileged position to be able to lead and champion and support your teams in relation to the delivery of an effective clinical risk management system, an effective clinical risk management process within your organisations, because it's absolutely pivotal. It's of great importance. It's all about reducing the risk of harm to patients through the enablement of digital systems, and is a key part of digital transformation programs. So please, 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 I implore you as the senior leaders that please take this seriously. It's not someone else's job, it's all of our jobs. If you are working in digital health, everyone has a responsibility to be able to make it their task to understand what clinical risk management is and where it affects their role and what they need to do in relation to that. And interestingly, as I was looking through the job descriptions and just reviewing them and trying to tease out the information in relation to this, it was quite alarming, actually, the number of those job descriptions that didn't actually mention patient safety and the responsibilities, and didn't mention clinical risk management as a framework in relation to those roles. So also, I think we need to take a step back, and any organisations that are out there that are advertising into those roles need to raise the awareness and need to make sure that that's included within those job descriptions. And lastly, on that point, you know, it's also look at the money those roles are commanding. I've seen it. It's between, so on those job descriptions and those adverts that I saw, it's between 85 and £122,000 per annum. Okay, so within those roles, you have a responsibility. You're getting paid a lot of money, okay, to deliver in relation to that. And lots of those roles are asking for experienced people. And dare I say it, in my experience, sometimes there aren't experienced people within those roles. I don't know why, and I don't know, why that's happening, but it is. There you go. I've stuck my neck out in relation to that, but it needed to be said. But what I'd like to do is, okay, if we flip that on its head and we turn that around, what do we need to do moving forward? Where do we take the positives from this, and how can we raise awareness? I think it's everybody's responsibility, and there's enough forums out there for us to raise awareness, especially at top management level, because when we talk to people on some of the episodes within the podcast, and also those people we will be talking to, I know that this will be raised, and it will be a topic that will be discussed around the lack of awareness. And what people tend to do when there's a lack of awareness, they tend to back off in relation to those subject matters in those areas, which is the wrong thing to do. What they need to do, they need to embrace it, and they need to find out what they don't know in relation to that, and not get on the defensive, and not try and palm this off onto somebody else. And I think it's a great opportunity for the NHS England sort of national CNIO, CCIO, to be able to try and push this forward. And I know I will be getting in contact with both of those people, and asking the question of what are we going to do at a national level? Because even if this is being mentioned or this is an issue at 3 or 4 health organisations, that's still too many, and it needs to be looked into, and it needs to be rectified in relation to that. So, hopefully we can use the resources available to us. We can implore clinical safety officers that are out there at whatever level you are within your health organisation, and also within the supplier community as well, that we need to be conscious of our own organisations and the message that we're giving across, because I don't think sometimes these people realise the damage that they're actually doing. Because we need to try and raise the confidence in an area that is key to the success of digital health projects. So a lasting message from myself: please be cognizant of your role, and the expectation that is within your roles, to deliver in supporting your teams. It's all about teamwork. It's all about the wider team in relation to what we're doing. So that's enough from me for this week. Thank you for listening, and we really look forward to episodes 5, 6, and 7 in relation to The Only Way is Ethics, and there are many more. We have an extensive guest list which takes us right into, I think, March or April next year, and hoping to get you sort of as much as possible a weekly episode for you to listen to. So thank you ever so much. You can find us on Spotify and on YouTube, and we look forward to you joining us again for episode 5.